Hello. So today we are going to discuss about vagina and its pathology. So first of all, what is vagina? Vagina is simply a canal that leads towards the cervix. So the epithelium which is surrounding the vagina is usually stratified squamous epithelium which is non-keratinizing. So the first disorder we are going to discuss is adenosis. So before going into the detail of adenosis, first of all let's see the development of the epithelium in the vagina. So there are two structures embryologically. One is known as urogenital sinus and other is known as the Mullerian ducts. So what happens is that urogenital sinus gives rise to squamous epithelium which covers the lower 2/3 portion of the vagina, and upper 1/3 of the vagina epithelium is derived from the Mullerian duct and which is usually columnar epithelium. So what happens that during the embryogenesis and during all that embryological period, what happens that squamous epithelium overrides the columnar epithelium and eventually converts upper 1/3 of the vaginal columnar epithelium into squamous epithelium. So if this process is disrupted during any time, so it gives rise to focal persistence of columnar epithelium in the upper 1/3 of the vagina, and that condition is known as adenosis. So what is adenosis? It is the focal persistence of columnar epithelium in the upper 1/3 of the vagina. And increased incidence in females, adenosis is having that increased incidence in females who were exposed to diethylstilbestrol in utero. So what is diethylstilbestrol? It's a synthetic form of female hormone estrogen, and it was prescribed to pregnant women between 1940 and 1971 to prevent any sort of miscarriages, premature labor, and related complications of pregnancy. However, this drug has been stopped in usage just because of its severe side effects. So adenosis is focal persistence of columnar epithelium in the upper 1/3 of the vagina, and this condition is associated with clear cell adenocarcinoma, which is a malignant proliferation of glands with clear cytoplasm. So clear cell adenocarcinoma is basically a malignant proliferation of the glands, and clear cell means when cytoplasm is completely clear. So vaginal adenosis gives rise to clear cell adenocarcinoma. So it's a rare but feared complication of diethylstilbestrol associated vaginal adenosis. So after discovering of this complication like vaginal adenosis and clear cell adenocarcinoma, and along with other abnormalities of uterus, for example abnormal shape of uterus associated with diethylstilbestrol, so it led towards the cessation of this DES, and now this drug is not used anymore. Now the other disorder which is worth mentioning is embryonal rhabdomyosarcoma. It's also known as sarcoma botrytis. So sarcoma is basically a mesenchymal proliferation. Rhabdomyo means that skeletal muscle. So embryonal rhabdomyosarcoma is basically a malignant mesenchymal proliferation of immature skeletal muscle, and it's usually rare. So it is malignant mesenchymal proliferation of immature skeletal muscle, and it presents as bleeding and grape-like mass protruding from the vagina or penis of child, usually less than 5 years of age. And this condition, as I've stated earlier, that it is also named as sarcoma botrytis. So rhabdomyoblast is a characteristic cell, and it exhibits classical cytoplasmic cross striation just like muscles, and on immunohistochemical staining it will stain positive for intermediate filament desmin as well as myogenin. So myogenin is a muscle-specific transcription factor that can induce myogenesis in a variety of cell types in tissue culture. It is a member of large family of proteins related by sequence homology, the helix loop helix proteins, and it is essential for the development of functional skeletal muscle. So what is happening in embryonal rhabdomyosarcoma? That rhabdomyoblast is the characteristic cell which is found in this disorder, and it will exhibit cross striation in the cytoplasm just like muscle, along with immunohistochemical staining positive for desmin, which is an intermediate filament and classical for that skeletal muscle, and myogenin, which is transcription factor. Then we will discuss briefly about vaginal carcinoma, and as we have stated earlier that the epithelium of the vagina is stratified squamous epithelium. So when the carcinoma is arising from that classical squamous epithelium that lines the vaginal mucosa is known as vaginal carcinoma. And it is also associated with high-risk human papilloma virus. So high risk were 16, 18, 31 and 33. So these four subtypes are the high risk and vaginal carcinoma, just like we have discussed in the vulvar carcinoma. So similarly, vaginal carcinoma is also associated with high risk human papilloma virus. And the precursor lesion for forming this carcinoma is vaginal intraepithelial neoplasia, which is basically a dysplasia or the disordered growth of the cell, but it is confined to its own place, and then it eventually after some time it will convert into the carcinoma, full-blown carcinoma. So the regional spread of the lymph nodes is also important because the lower two-thirds of the vagina, the spread of the cancers or metastasis will go towards the inguinal nodes. So the lower two-thirds of the vagina, the metastasis is going towards the inguinal node, and the upper one-third of the vagina metastasis is going towards regional iliac nodes. And the last disorder we